You need to share your screen. So there are the three dots. You need to press the three dots and then
My
yes,
yeah, my screen is visible
yes.
very much. Okay, thank you very much for giving me this opportunity, Dr. Mansi ma'am. And warm welcome to all the participants. Today we know that the content or the agenda that we have, especially this webinar is designed for students, those who are currently doing their masters in psychology or clinical psychology. And of course, this topic is also important for people, lay person, those who are dealing with psychological issues, but they don't know what to do when a person who is going through the distress. As you can clearly see that uh, responding, like the title is responding to emotional distress effectively. So many a times it happens that there is a person with emotional distress, and since we don't know what to do with this, how to help this person, and because of lack of awareness sometimes, or because we don't know what to do, so we find it very difficult to help the person who is in emotional distress. So the terminology that we use is providing them psychological first aid. So why psychological first aid is so much importance? We all are aware about what to do when there is a person who is maybe experiencing hypoglycemia. We all know what is mean by diabetes mellitus. And we know that if a person who is going through hypoglycemia, how to help this person out. We know when there is a person with hypertension and then going through some issues because of hypertension. But unfortunately, still in 2026, we most of the people they don't know about what to do when there is a person who is going through emotional distress, especially as the today's topic that you can clearly see on the title slide is how to deal with panic attack. I have seen many children, students, those who are doing their psychology course, and they are sitting in the classroom, and somebody is getting panic attack, and there is a sudden fall, and the person is getting faint, but they don't know what to do with this person. If we are talking about people or student, those who are doing psychology, then think about lay person, they don't know about psychology, or they don't know what is meant by panic attack and how to provide help to this person, the person. So I think this is one of the important skill that we need to adapt, that we need to inculcate, so that whenever there will be a kind of a situation and a person is there who is in immediate need, maybe we will be better able to help this person. So this entire session is devoted to understand what is mean by panic attack and how to provide first help. So let us begin with a small case study. This case study is about a client who was referred by actually her roommate, where I was working as a psychologist in a wellness center, in-house counseling center in university campus. So this is a real case study. I have changed name of this girl. Let us begin with the case study. So she was a girl who took admission in the department for BSc psychology program, and like her history was like this, that the girl was having below average intellectual capacity in her academics. So this was not clear when the girl was approached or brought by her friend. So the part that I'll be disclosing is the part that I was able to know when I was started collecting the case history. So this girl was not able to do well in her academics when she was in her school days. and it was affected her grades. As you can see, when there is difficulty in analytical thinking, problem solving, and the academic performance is below average, she was struggling with science, mathematics, so subjects where a lot of analytical thinking is required. She was more interested and inclined towards literature, poetry, and creative writing, but at the same time, she belonged to a conservative, typical middle class family where entire focus of family was helping her to understand that literature is something that she should not do, and she should hold degree where she should get name, fame, and of course money. So, because of parental pressure, she took admission. She enrolled herself for psychology program, and she was resident of Madhya Pradesh, but because of parental pressure, they wanted her to enroll in the best college. So she took admission in Pune city, Pune University. So when she got enrolled herself in a different state altogether, it was very obvious that she also started living in hostel room, and she started attending classes later on. So gradually she started observing lot many issues related to academic performance, since the concepts that the teacher they were teaching during the classes, she was not able to grasp all the concepts the way other classmates were able to do, and she was finding it difficult to write analytical assignments and participating in classroom discussions. So gradually, this feeling of inferiority, which was already there in her mind, it started increasing day by day, and there was a kind of piled up academic anxiety. So she started avoiding classes, and she started having discussion with her classmates, or maybe making new friends, or having discussion with her uh, class teacher or the other teachers to with whom she can discuss and try to find out what to do with this. So after some months, she started experiencing kind of symptoms. Symptoms were gradually, they started getting increased day by day, where the symptoms were including like sudden breathlessness, episodes of sudden breathlessness, feeling of suffocation, rapid heartbeat, dizziness, trembling, and loss of control and faint. So we all know, being student of psychology, that all these symptoms are related to panic attack. Those who don't know about what is mean by panic attack, let us discuss about what is mean by panic attack. So panic attack is a kind of a situation. It happens suddenly at any given point of time. It is like a wave. So it comes and goes, but when it comes gradually, the distress or the symptoms, it starts getting increased, where it includes chest pain, racing of heart, difficulty breathing, and hyperventilation. Apart from that, some of the people, they also show symptoms like nausea, sweating, tingling, and numbness in their fingers and toes. So, in all, in general, the person, whoever is getting panic attack first time or repetitively, they feel intense terror during this period because of choking and suffocation, and they also feel that they are going to die. So all this happened because there is a lot of emotional distress through which the person is going, and they feel that they are stuck and there is no solution to deal with this situation, and everything happens unconsciously. So the person find it very, very difficult to deal effectively with this. There are certain clients, they also experience feelings of unreality. This we call it as derealization. So what do we mean by derealization? Where a person feels that the person is not part of the surrounding. This happens because of the sudden and intense fear and anxiety. And yet another symptom is depersonalization, where they feel that their body parts are not their body parts. So imagine that a person who is experiencing such kind of physical symptoms or different types of emotional and psychological symptoms, they feel terrified, and entire episode is very unpleasant, and they are they this is something which is very like scary. So when Ananya started experiencing all these symptoms and she was not aware that she is going through panic attack, she started avoiding leaving hostel room as well. Because what she started observing is whenever there will be a kind of a thought that now she has to get ready and go and attend classes, she used to get panic attacks. Yet another situation where she has started experiencing is whenever she used to get calls from her parents, how like they were usually asking about her academic performance, assignments, and what teachers are talking about her assignments and performance, and then the classmates and the college and sorry university environment. So there were certain reasons where she started observing that during the day she used to get panic attack, and to avoid this panic attack she started avoiding leaving her hostel room, and it automatically started affecting her not attending classes regularly, not studying and completing assignments, not interacting with her classmates or her friends, and she preferred not to get along with any person. Apart from that, she also mentioned during the counseling session that she has started observing loss of appetite was there, and she was skipping meals, and because of this she started feeling weakness and fatigue and disturbed sleep. So this was all about her issue. And then during the discussion, we also discussed about why people get panic attack. So I just wanted to know if anybody is interested to throw light, or if you know you have learned this during your classes, or maybe based on your experience, you can share your like ideas about reasons behind panic attack. Would you like to share something about this? Why do people get panic attack? Is there any specific reason that you can list out? I just wanted to request all participants, if you keep your camera on, that will be really great, so that you all will feel that we are having some interaction with each other, and we can share our ideas about panic attack and how people deal with panic attack.
Excuse me, ma'am. I just have a humble request. Can you click on that slideshow? Because on mobile screen, it's not it getting a smaller vision.
Is it visible now?
Thank you, thank you.
Actually, because of this, I'm not able to shift my screen and I'm not able to see any participant.
By your convenience, madam. Definitely.
Okay, ma'am. All right. You can do as per your convenience, ma'am.
Yeah, just for a few minutes, maybe once we have discussion about like why do people get panic attack, then later on I'll shift it to slideshow.
Okay, okay, ma'am.
Any participant from audience would like to throw some light on why do people get panic attack? Is there any specific reason?
Come here, come here. One of the reasons for panic attacks
Observing
can be
violence.
suppressed emotional.
I guess one of the participants, she said Nidhi, I guess, observing violence. Yes, maybe Nidhi. Yes. Sorry, you are not audible, beta. Stress. Yes, Karuna. The student is
Participant is
not audible, ma'am.
saying that she's saying that is it all due to the suppressed emotion?
Suppressed emotions. Yes. One of the major causes is suppressed emotion. Yes. Anybody else wanted to include in this list?
Can it be due to fear?
Yes, due to fear, definitely. Yes. One of the major reason is fear. Contributory factor is fear, suppressed emotions, stress. Yes. Vaishnavi or Siddhi, Dr. Sharda. Okay, so let us see what exactly psychology wanted to say about unable to discuss with family members. Wonderful, Karuna. Thank you very much. So let us see, let us discuss about why do people get panic attacks. So this is not only related to panic attack. Okay, so how people get psychological symptoms, okay, or psychological illnesses or disorder because of different factors that may be this flowchart will be able to help us to understand more about the reason. So to know more about this, like being a mental health worker or a person who wanted to provide first aid, need to know about this so that accordingly we can make changes while providing first aid, psychological first aid. That is why we need to know about this, the reason or the causal factor, etiology of why people get panic attack. Okay. So as you can see that there is an event. So this event can be anything. So if we are talking about this girl whose name is, hypothetical name is Ananya, so she got a panic attack. So the reason behind this is, as you can see on the screen, that there are certain factors continuously they are affecting our cognitive appraisal. What do we mean by cognitive appraisal? So the way we are perceiving any event or the thoughts that come to our mind whenever we are experiencing any event. So there are lot many factors that are contributing to the thought process that we are currently holding. So one of the important causal factor that we can say or we can list out is genetic influence or family history. So this genetic influence, how it affects. So if there is a person in the family who is having history of mental illness or having typical kind of personality, so they pass this as it is to their next generation. But this is not sufficient, but can be one of the important factor that can affect a person to develop different types of mental illnesses, disorders, or vulnerability towards getting panic attack or maybe different types of symptoms that we can see in different types of mental disorder. Okay, so this is one of the important reason that we can list out. Second factor that you can see in this image is past experiences and family history. So let us discuss about what kind of experiences this girl was going through. So this girl was raised in a family which was conservative family, typical family, Indian family, where in all Indian families, you can clearly, visibly see that if a child who is not doing good in academics will always be pressurized by the parents to do good in their studies, to do well in their academics. Why it is important? So that they should be able to hold good job. And for us, good job means prestigious job. For example, still we have this idea in our culture and society that one should like become doctor, engineer, or CEO of a company like that, or professor in a big university. If a person who is not able to do this or not choosing typical kind of jobs, then definitely the culture, the family members, and own self as well, because we internalize all these things as it is. We start feeling that we are not capable enough, we are inferior from people around. So this is kind of a second factor, contributory factor, where past experiences are influencing and genetical factor are influencing cognitive appraisal or thinking pattern of Ananya. And then the existing condition. So look at existing condition of Ananya, that this girl who was having below average intellectual capacity, where all her responsibility was taken care by her parents till the date when she was there in her hometown. Now there is a clear-cut incident or clear-cut change in her life, that she has not only changed her city, but also entire state. Problem solving, decision making, and the other important aspects of her life was taken care by her parents. And now here in the hostel, she's the one who has to take all the decisions for herself, which was very difficult for this girl, having below average intellectual capacity. On top of that, she enrolled herself for a course which was very difficult for her. So altogether, this has started somewhere affecting her cognitive appraisal. Now, what happened next? So she perceived entire situation as harm and threat. There is yet another possibility that many of the people, they can consider this situation as a challenge or opportunity. So people with good resilience capacity can consider situations in their life as challenge or opportunity. Can you tell me, there was a situation where many people, when they were panicking, there were some people, they consider this entire condition as opportunity, and they were able to make most out of it. Can you give any example of this kind of situation? We all have experience, we all have gone through this similar kind of experience recently.
During the COVID situations, many
Yes,
people developed good businesses sitting at home.
yes, wonderful. Yes. So this was a kind of a situation where most of the people, when they were panicking, they were like under stress and threat that what will happen next, because medications were not available, treatment was not available, what to do was like people were confused and unaware. Some people find it like a kind of a good opportunity, and they started able to like establish entirely new business ideas altogether. So situation was same for all people, but dealing pattern was different. So challenges, they consider this as challenge and opportunity, where people who are having such kind of predisposing factors like Ananya, they can consider the same situation as harm or loss or threat. And that is why some people, they take up maladaptive coping strategies, and some people are able, who consider this as an opportunity or challenge, chances that they can take up adaptive coping strategies. So in Ananya's case, it is quite visible or easily like understandable that she adopted maladaptive coping strategy, and her coping strategy was showing physiological symptoms of mental illness. So even though the problem was psychological, you can see that presentation of symptoms can be physical. So not necessary that all psychological issues or all emotional distress will get reflected through only psychological symptoms. So if we are considering, today's session is on panic attack, so we are giving more focus on somatic part or physical symptoms of issues. So if we see case of Ananya, you will find that most of her symptoms are physical by nature. Why physical by nature? Because mind and body both are connected very closely. That is why in Ananya's case, when continuously her nervous system was giving a kind of indication that you are under threat. So when the brain is giving such kind of what to say indications, so the body is getting also affected, because both are closely connected or tied with each other. So now the brain is giving indication, and the body parts like heart is showing symptoms like increased heart rate, or maybe rapid breathing is there, dilated pupils are there, muscles are tense, and digestion is slow. Why these changes are there in the body? So that the body can prepare oneself for fight or flight. So she is experiencing all these physiological changes in her body, as well as there are hormonal changes like we call it as HPA. HPA is hypothalamus pituitary adrenaline changes. So hypothalamus is giving indication to pituitary gland that there is a condition which is threatful. So release adrenaline. So adrenaline helps body or prepares body for fight or flight. Now, because of these indications that continuously she is getting, that she is under threat, she took up this symptoms of panic attacks. So this is the reason why Ananya was getting panic attack, as she was not having adaptive coping mechanism. So now we know that Ananya was getting panic attack. We have seen that what kind of symptoms one can see when a person is going through panic attack and causal factors behind panic attack. So as a mental health worker who is providing psychological first aid, who doesn't know anything about psychology, who never take a course of psychology, should also be able to do effectively or help the person effectively provide first aid, what to do. Okay, so this part is very important for us. First thing that we need to know that this entire first aid program is not for diagnosing a person and providing treatment to the person who is in need. So make it very, very clear that this psychological first aid program is designed for people, those who are not professionals. This psychological first aid program is for people, those who are non-professionals. Since they are non-professionals, they are not there to diagnose the person that this person is having panic attack, or they are not supposed to provide counseling service like the way clinical psychologists provide, so that they can help the person to reduce panic attack and then deal effectively if the person is going through the panic attack. Their job, first aid worker's job, is to provide only first aid during that situation. So whenever you will observe that somebody is getting panic attack in any situation, you should be able to work like a first aid mental health person who is providing that facility. So what to do, or what is the role and responsibility of this person? So the person is supportive and compassionate. So approach during entire this episode is the psychological first aid provider will be supportive and compassionate, and their aim is to stabilize emotions, reduce distress and behavioral reactions to the panic attack or distressful situation. So we are there to stabilize their emotion. Now we all know that during the panic attack, the person is going through terrible experience. So you will be helping the person to stabilize emotions and reduce the distress, so that you can restore their adaptive function. Now, since they are under distress, they are not capable enough to deal effectively with the situation. So a person who is providing psychological first aid will help them so that they can regain the capacity of adaptive functioning. And then last is linking this person for professional care and continued support. So this should be the goal or role of the person who is providing psychological first aid. I just wanted to ask participant, is this speed okay and are you able to understand and follow the content? Is there any clarification If required, just do let me know so that we can actually go into the model where this model will be helping us to understand what exactly you are going to do during this period of panic attack. Should we proceed further, ma'am?
Yes,
Okay.
ma'am.
Yes, ma'am.
Okay. So there is a model, wonderful model designed for providing first aid program. This model is called as RAPID. Now look at the acronym that they have used. RAPID is instantly you should be able to provide help to a person who is going through panic attack. Now this RAPID stands for something. Let us go through in details. R is for rapport establishment, A is for assessment, P is prioritization, I is intervention, and D is disposition. So who will be doing this? The person who is providing psychological first aid. Now the first is rapport establishment. Since you all are psychology student, I'm assuming that you all are aware about what is meant by rapport, but let us go through this again, this concept. So we all are aware that why do we need rapport? So how, in what way this rapport will be beneficial for a person who is experiencing panic attack? Now this person is feeling that she or he or they are going to die. Look at the level of distress this person is going through, and because of the choking sensation, because of the suffocation, hyperventilation and everything, for a time being they can feel that they are going to die, they are going to lose control, and this is something terrible which is happening with them. So during this period, a person who is providing psychological first aid, they are helping to create a kind of an environment, calm environment, where they wanted the person to understand that they are in safe hands and safe place. So how we can do this? So the first thing is we need to know that what are the symptoms that a person can experience when they are going through panic attack. If we don't know, we are not aware that this person is having panic attack, we will not be better able to help the person. So we should have that confidence in ourselves so that then only we can be there with them with calm presence. Second step is reflective listening. This is something very important skill that we need to inculcate. So what does mean by reflective thinking is helping them to understand that you are there and you are trying to understand their problem, foster their understanding and validating their emotions. So I have observed many a times it happened that when people, those who are not aware about panic attack, and children or university students, when they get panic attack, and teachers and the other students who don't know that they are going through panic attack, what they try to tell them, देखिए आपके जैसे बाकी बच्चे भी कर रहे हैं, आप क्यों डर रहे हो, देखिए वो कितना अच्छा कर रहा है, आप भी कर सकते हो कोशिश करने के बाद. ठीक है. So this is not the right time to give them advice that you can do it. Yes, you can do it, because they are not capable during that period of time, because they are feeling that they are going to die. इस समय जो आपकी एडवाइस है कि देखिए बाकी बच्चे भी कर रहे हैं, डरिए मत, मैं आपको इवैल्यूएट नहीं करूंगी. See, these are not the things, these are not the advices that these children, these students or the person require during this period of time. What they wanted is to validate their emotions and their issues during that period of time, that yes, I can understand that this is something terrible that you are going through. I can understand that you are suffocating. Your heart is beating very fastly. There is sweating. Okay, so mere your calm presence is required for them, and your gestures and body language matters a lot. Three important skills that we use in counseling sessions. That is empathy, unconditional positive regard, and congruence or genuineness that you can use during this period, where empathy is your entirely providing them kind of understanding that whatever you are experiencing, I can understand that this is something terrible and you wanted to come out of this and I'm there to help you. Providing unconditional positive regard is in spite of understanding that this person is making mistake, person is not attending classes regularly, maybe not submitting assignments on time, yeah, or maybe not involving in group discussions or doesn't have good interpersonal relationship with people around, still your unconditional positive regard is what is required. Can you tell me any good example of unconditional, whatever you have understood from this important technique, unconditional positive regard? What do you mean by unconditional positive regard? Because empathy बहुत सारे लोग बता सकते हैं. Let us discuss about what is mean by unconditional positive regard. Any student who
Not
is
judging
interested?
a person
Yes. Not
and then
judging a
active
person.
listening.
Yes. वंडरफुल. सो उन्होंने कपड़े कैसे पहने हैं, वो कौन से कल्चर से है, उनकी लैंग्वेज क्या है, आप उनको जानते हो नहीं जानते हो, या आपने उनको देखा होगा शायद बाहर कुछ उटपटांग सी चीजें करते हुए जो उन्होंने नहीं करनी चाहिए, या दे आर ब्रेकिंग रूल्स सोशल नॉर्म्स, बट स्टिल इन स्पाइट ऑफ दिस you are providing positive regard to that person during that period of time. Yes, I'm there for you. This is what is unconditional positive regard is. Third thing is genuineness. Most of the time we lack in that. How? So whatever we are expressing through our words, it also should get matched with the body language that we are using. So if we are not really offering unconditional positive regard, we are not judging them. So it should also get reflected through our body language, voice modulation, facial expressions and everything. जैसे कि कोई टीचर बता रहा है जिसको पता है कि ये बच्चा आता ही नहीं है, ठीक है, या उसको मैं हमेशा बाहर कैंटीन में देखता हूँ, या ये जो मेरा क्लासमेट है उसको मैं हमेशा बाहर घूमते हुए देखता हूँ, ठीक है, उसकी किसी के साथ बनती नहीं है. Now if we know this, then automatically we become judgmental and it get reflected through our voice modulation, facial expression. And when there is incongruence between these two, person easily can understand that this person doesn't care for me. So this is where this we call as a micro skill that is required when we are offering rapport establishment for a person who is going through panic attack, or for that matter when you are working as a providing psychological first aid. So rapport is very critical for us because through rapport only we can establish trust and then the cooperation that is required for further intervention. So if you are able to establish good rapport, half war is done. In this rapid model, second part is assessment, which is very important and crucial. So in assessment part, it is our job to evaluate, to assess symptoms. So what kind of symptoms the person is going through. So if we divide symptoms into 4 categories, first is physiological symptoms that the person is experiencing. So for her case, maybe hyperventilation was there, increased heart rate was there, dizziness was there. Second domain is cognition, where what kind of thoughts are going on inside her mind during the panic attack. Maybe the person will tell you कि मुझे ऐसे लगता है कि मैं फेल हो जाऊंगी, या फिर मुझे ऐसे लगता है कि मेरे पेरेंट्स मुझसे नाराज होने वाले हैं. I'm not able to satisfy them. I'm not a good child, or I'm not enough. I'm inferior than my classmates, like that. So chances that you will be able to get what exactly going inside her mind during that period. Next is emotional. How much intensely the person is experiencing emotion of fear, threat, sadness, anger, whatever, and then the behavior of that person. So this is one of the important job, role or responsibility that need to be carried out by the psychological first aid provider to evaluate, assess symptoms of the person who is going through panic attack. Second thing that you will be assessing is the triggering factor. So अभी इसके लिए जो moment पे the person is going through the panic attack, what happened just before the panic attack? If possible, try to evaluate that. So it might be any triggering factor. Okay. So here I am able to list out some of the factors which are related to this case study. पहला जो है वो academic triggers हो सकते हैं. हो सकता है कि this girl is sitting in the classroom and she got panic attack because she was finding it difficult to understand theoretical concepts, or maybe she was not able to participate in classroom discussion, or there is an announcement of upcoming assignment submission or upcoming say examination, and that is why she this panic attack was there. Or there is underlying psychological trigger, like she has started feeling that she is not enough, or maybe there is a feeling of trap. So this is kind of a psychological trigger that causes panic attack. Or social trigger, like there is continuously parental pressure, and morning में she got a call from her parents that आपकी स्टडीज कैसे चल रही है, कॉलेज में क्या हो रहा है, आप क्या कर रहे हो, like that. Or maybe people are not involving her in their group because she feels that she should remain alone. So this can come under सोशल ट्रिगर. और सिचुएशनल ट्रिगर भी हो सकता है, जैसे कि टीचर्स घूमते हैं क्लास में तो वो टीचर नजदीक आ गई होगी, या फिर शी इज गोइंग टूवर्ड्स वॉकिंग टूवर्ड्स हर क्लासरूम. So these are some triggering factors because of which she probably might have got this panic attack. And under the assessment part, you are trying to assess, you are trying to evaluate कि अभी का उसका ट्रिगर क्या था. Next is severity, which is very important because this will decide what kind of treatment is required for this person. So mild, moderate and severe crisis. So mild crisis may a person who is going through mild crisis is able to carry out mostly day-to-day life functioning. If the student or the person is going through mild issues, mostly they can maintain their day-to-day functioning. If they are experiencing moderate level of distress, it start interfering, affecting their occupation, academics, social function, and because of this, they start adopting one or the other defense mechanism. And third is severe crisis, where people can experience psychological illnesses or self-harming injurious behaviors. So now, being psychological first aid provider, our job is to evaluate quickly level of severity of distress. And last thing that we need to evaluate is risk factor. This is very, very important. Please give your entire attention towards this. If you see all the symptoms that the person is experiencing during panic attack, like breathlessness, suffocation, rapid heartbeat, or maybe sweating and everything, chances that this person is going through heart disease. So during that situation, the questions that you need to ask to the person is, are you experiencing severe chest pain? Do you have any known heart condition? And did this start suddenly? So these three questions are very, very important to understand that whether this episode is panic attack or any undiagnosed, undetected heart condition. If It is undiagnosed and undetected heart condition. आपका साइकोलॉजिकल फर्स्ट एड वहां पर काम नहीं करना चाहिए, आपको उसको वही बंद करना चाहिए. Do not proceed further and take the person immediately to the hospital. If the person says that, no, I have experienced this before, or the person is conscious, person is able to communicate with you and is not expressing any suicidal ideation, then you can move further. That is why we call this as prioritization. Prioritizing that how much severe, intense is the situation and what kind of intervention is required during this situation. So either you will be taking this person to the hospital for heart related diagnostic processes, or you will be providing them psychological first aid, depending on the severity. So rapid may we have seen R is rapport, A is assessment, P is prioritization. Let us move forward. Now we know that this is a Pionic cycle explanation: stress, physical symptom, catastrophic thoughts, and more anxiety. So stronger physical symptoms. So for stronger physical symptoms, I is intervention is required. So some techniques are there given here, step 1, 2, 3, 4, 5. So first technique is you will be helping them for controlled breathing. Beautiful and very simple method that you can apply. Help the person to give entire focus on breathing exercises, where you will be asking the person to inhale slowly through nose, and then you will be counting 1, 2, 3, 4. So you will be asking the person to inhale, hold the breath inside for 2 seconds, 1, 2, and then ask the person to exhale slowly. While exhaling, you will be counting 1, 2, 3, 4, 5, and 6. So this exercise, this cycle of breathing, you will be doing for several times. This will help the person to regain or balance oxygen level. Then, because of this breathing exercises, nervous system calms down and person can experience that heart rate is also decreasing, which was increased because of the panic attack. This is very simple method. Anybody can do. So I don't think so for this we require a lot of training. You can also do it for yourself so that you can help the person in better manner. Next step is grounding technique. What is mean by grounding technique? So this grounding technique help the person to be in present moment. Why do we bring the person into the present moment? Because we can also see from our own experiences that whenever we are dealing with any distressful situation and we are panicking, we are in anxiety, we don't know what to do, we all know that we are not in condition to do problem solving. Because in this situation, in fearful situation, panic situation, either you are thinking about the past experiences or the future. ऐसे होने वाला है, ऐसे हो जाएगा, ये होगा, वो होगा, ये बोलेगा, मैं फेल हो जाऊंगी या मेरी जॉब चली जाएगी, ठीक है. So whenever we are under that threatful situation, our prefrontal cortex, the problem solving area, is not able to function well. So to bring down that person into the present moment, this grounding technique helps a lot. So what we ask the person to do is, we ask them, okay, can you tell me 5 things that you can see? आप पूछिए उनको 4 things that you can touch, 3 things that you can hear, 2 things that you can smell, 1 thing you can taste. ठीक है. सो यहाँ पे उनके आंसर कितने करेक्ट आए हैं उससे हमें लेना देना नहीं है. Here we wanted to bring their attention into the present moment. So gradually you are helping them to calm down and start thinking about what exactly is going wrong with them. So we have seen two techniques. One is breathing. Breathing is to increase oxygen level in their body. Second is like bringing them to the present moment. Next is psychoeducation. Now we know that uh, the person is panicking under entire threat fear. So providing psychoeducation helps them to understand that what exactly is going wrong with them. So you are telling them, helping them to understand that this is panic attack. And like we know that you are feeling very threatened, but don't worry, this is not dangerous. You are not going to die. Many people, they get panic attack, but soon you will feel comfortable. Don't worry about that. And then you are trying to explain about more about panic attack. Okay. So you will be telling them that panic attacks are temporary and symptoms will pass, and the body is currently reacting to the stress that through which you are going. Next technique is cognitive restructuring, where you are trying to find out what kind of thoughts are going inside the brain of this student or the person. So maybe the person will tell like, what if I collapse in front of everyone? What if my parents, they get annoyed that I have got less marks in my examination? So here you are helping them to restructure their thoughts that no matter, we know that your body is overwhelmed right now, but body is overwhelmed because of panic attacks. So don't worry, even if you fall down, nobody will judge you. Don't worry. You are there to help them. Even if they are panicking that what if their parents will give a call and they will feel disappointed. Let us have sit down conversation with your parents once you will start feeling better. So this type of messages you will be able to provide during the panic attack situation. Then behavioral stabilization. This will also include or can impact the person to regain control over their body, like providing them a sip of water, asking them to stretch their body, then focusing on breathing and helping them to move towards the जहाँ पे quiet places, quieter area में you are helping them to move. And last is stress coping discussion, like is there any method that currently we can apply so that you will feel calm and comfortable? Maybe soft music, maybe taking a small walk outside. Like that, you can ask them. So whatever they prefer, whatever they choose, you can help them to carry out that activity. So these are 6 steps that you can apply. And D is disposition, which will help us to evaluate whatever help that you have provided during this entire episode, whether or how much the person is feeling better. If the person reports that now he or she is comfortable, then help the person to understand that how counselor or psychiatrist or psychologist will be helpful for them to deal effectively with further such kind of situations. So helping them to contact to a professional who is skilled and know what to do with such kind of uh, people, those who are going through panic attacks. So we call this as disposition. So what we have seen under rapid model is whenever there is a panic attack incident, you will be establishing rapport, then you will be doing assessment, then you will be prioritizing, understanding that how much the problem is severe, and then you will be starting intervention. And D is for disposition, where referral to the counselor, psychologist, or a clinical psychologist, and providing them follow-up support as and when required. So overall, this rapid model help us to respond quickly to emotional crisis. It helps us to stabilize acute distress, and a lot of evidence-based like interventions people have tried to carry out with the help of rapid. So this way you can actually provide care to people, those who are going through such kind of situations like panic attack. So this is all from my side. Thank you very much for patient listening. And if you have any doubt, any question regarding this, please do let me know. Yes, Vaishnavi.
Thank you.
Thank you,
Thank you so
ma'am.
much.
You
Now we will move toward our question answer session. If any participant has question, you can directly ask you or raise your hand. From audience,
yes,
if
ma'am.
anyone have a
I,
question, please come.
Hello, Vaishnavi. You are on mute.
yes, ma'am. I have a question. Uh, actually, you have you wonderfully explained each and every point, but my question is related to intervention technique. Uh, if someone refuse to take the help, it can happen. So, what we should do, what we can do at that time?
During the panic attack?
Yes, ma'am.
Okay. So, see, there are chances that person refuse to take help when the psychological first aid provider has not is not able to establish good rapport with the client. This is the only what to say condition when they refuse this help. Second thing
Yes,
is,
ma'am.
so like the way you are offering, providing rapport, establishing rapport makes huge difference. Even if there is a lot of grudges or like in between, like a person who is living in a hostel room, and then the room partner, like they don't have good interpersonal relationship, and this person is going through panic attack. Still, if you are able to provide rapport during that point of time, definitely that person is in need, so they will not refuse this kind of help. So like this is a kind of a technique that we need to maybe acquire efficiently, or we need to put a lot of effort so that you will be able to better able to provide such kind of help. I hope I have
Thank you, ma'am.
satisfied your question answer.
Yes, ma'am. So basically, we have to focus on rapport building.
Yes.
Yeah. Thank you, ma'am.
Thank you, Vaishnavi.
Ma'am, my question is, for a person who has repeated panic attacks, like frequency is more, how does that shape their understanding of control over themselves?
How? What?
How does that shape their understanding over the concept
Second
of
part
control,
I'm not able
self-control?
to hear, beta. Second part.
Ma'am, if I have recurring panic attacks again and again, so my control is slipping. So how is that
Control.
going to affect me in my life? Yes.
Yes. So that is why what I mentioned is this rapid model is only for providing psychological first aid. But a person who is continuously going through panic attack, so they need to take professional help, because we all know that like through different psychological perspectives and theories of counseling, being a psychology student, that there is deep rooted unresolved conflicts, which is the root cause of this panic attack, apart from uh, the genetical part that we have discussed under the causal factor, right? So providing psychological first aid is not sufficient. Here, the person, the psychologist or the clinical psychologist, they help them to understand root cause of the symptom and how to deal effectively with this, like the adaptive coping mechanisms that they need to acquire. Otherwise, this panic attack will never be get cured at all or addressed at all. आप सिर्फ ऊपर ऊपर काम कर रहे हो बट नीचे जो प्रॉब्लम है वो ठीक ही नहीं हुआ. ठीक है. So the person will continuously they will show panic attacks that will not get reduced. So for that, proper sessions, psychotherapeutic sessions are required. ठीक है. So this is the only method actually to reduce recurring panic attacks along with good quality medications for some days, of course.
Any questions from audience? Okay. Thank you everyone for this thoughtful questions, and thank you Dr. Amruta ma'am for your valuable responses. Now we are moving toward a vote of thanks. Thank you so much, Dr. Amruta ma'am, for this wonderful session on panic attack. Like you have discussed the topics, why people get panic attacks, and when they get panic attack, being a psychology students or non-psychology students, how we have to respond it, the psychological first aid. Then with the case studies you have earlier explained, you have explained all the intervention process beautifully. So it's like in a treat. I just want to share my personal experience here. While I was pursuing my master's in psychology during my internship at Shanti Nursing Home, I had the valuable opportunity to observe and experience the professional skills of our esteemed speaker, Dr. Amruta ma'am, as a psychologist. Watching her interact with patients with such an empathy, patience, and professionalism was truly inspiring